Salmon, in addition to having high protein and astaxanthin, also contains essential fatty acids, the omega-3s. And when I say you need fats, we're talking about fats like the omega-3s. They said they're essential because they are essential to our health. And the omega-3s are natural anti-inflammatories. And if anti-inflammatory obviously brings down the level of inflammation throughout the cells, but it also nourishes every cell in your body, enhances your memory, your immune system, makes your skin absolutely beautiful, lubricates your joints, helps you burn body fat. And now we know a lot more about omega-3s. And I'm going to discuss that probably in segment 3 when I talk about the metabolic miracle diet. Because omega-3s are so powerful that they turn on certain receptors in the body called nuclear receptors that actually change the way we deal with food and metabolism. And it switches us to fat burning rather than fat storage, regulates blood sugar, and also increases bone density, muscle mass, a long list. And all this is from eating this little piece of salmon. So it's a famous fish, and it should be. The next piece is big green salad. Well, there's color there. We want to put some olive oil and lemon juice. And, of course, there's fiber, and there are phytonutrients. One of the themes of today's talk, because it's been 10 years since the first book, is that we've gone beyond antioxidants now. We now know that phytonutrients are much more powerful than being just antioxidants. So if you think about the battle between the good guys and the bad guys are free radicals looking for an electron, and an antioxidant comes along and hands them an electron, neutralizes them, the antioxidant is now used up. Well, it goes well beyond that. And we're going to talk about that because the term for this is nutrigenomics. And you may not be familiar with that term, but that's the future. Nutrigenomics and epigenomics. And so we're going to look at that today, and it's fascinating to look at because we're well beyond where we were a decade ago. We're not going to be just looking at foods as a source of antioxidants that can be used up as it protects us. On the salad, we have olive oil. Olive oil is a monounsaturated fat, and you need monounsaturated fats because it actually assists in taking in essential fats. Also, it contains a powerful antioxidant called hydroxytyrosol. Cardioprotective, so reduces the chance of heart disease. Of course, it beautifies your skin and your hair and a number of things. So olive oil is the key. Lemon juice, lots of vitamin C. And being that I'm a vitamin C nut and take about 4 to 5 grams a day in divided doses and a little white powder, gets me in a lot of trouble sometimes, by the way. Then we go to dessert. Berries. So you have blueberries and raspberries and strawberries, all those beautiful colors. And those represent different phytonutrients and antioxidants, anthocyanidins. Blueberries are protective of our body in many ways. They're neuroprotective. They protect brain cells, dopamine cells, prevent problems with dopamine. So now, dopamine cells are extremely important for emotion, and people with really low levels of dopamine end up with Parkinson's disease. If you want to maintain a sharp memory, blueberries. Now, when I was a medical student, I noticed when we were doing pharmacology that anytime a patient was administered a psychoactive drug or something that was active in the central nervous system, I saw a change in their skin. And I saw this consistently, and fortunately we were taking a lot of courses at the same time. And embryology taught us that basically the body is all derived from 3 separate layers of tissue. And the skin comes from something called the ectoderm, and so does the brain. So I call it the brain-beauty connection. So that kind of keyed me in that if something is therapeutic for brain, it's going to improve your skin. And so that brain-beauty connection actually led me down a very, very important path that led to developments of things like dimethylaminoethanol for skin, and some of the newer things we'll be looking at today. The blueberries, we now know, contain an antioxidant called catechins. And that's found in green tea and chocolate and cocoa and a number of them. And we were all talking about the wonders of catechins in green tea and as cancer prevention and enhancing our mood and making our skin look better. And it's interesting that those molecules of catechin are not just antioxidants. They go beyond antioxidants. So this theme's going to keep on coming back today, because a decade's gone by and we just have a lot more information. And this information is critical, because if we use this information correctly with foods, we can prevent cancer. We can prevent wrinkles and obesity. We can prevent every disease category that you can think of by manipulating our gene pool, nutrigenomics. So what the definition of nutrigenomics, I'm going to say this probably 4 times over the next hour, but it's that important. It is the study of the interaction of diet and gene expression. And so you're no longer locked in to what your parents gave you. And so you don't have to age like your parents did. And Many times I'm giving a lecture and I'll talk about diet and prevention, and they always say, Dr. Perricone, but isn't it true it's all genetics and if this is going to happen, it's going to happen? There's probably two reasons they're asking that. Number one, they don't want to take responsibility. Okay, set my genes, let me eat the pizza and the beer and just live out my life because it's going to happen. Well, that's not true. Okay, it's not true at all. And secondly, they're probably asking because maybe they want to try to help themselves. So that is tier one of the anti-inflammatory program. Tier two actually consists of taking nutritional supplements that have anti-inflammatory activity. And we talked about this a decade ago, and now it's been reinforced because everything we talked about has really proved to be extremely therapeutic in many ways. And we talked about things like alpha-lipoic acid and vitamin C ester and vitamin E, and what are the effects? Well, we knew then that antioxidants act as cell messengers. And so if we have an event that's pro-inflammatory, like we walk out in the sun and we expose our skin for, say, 45 minutes, we have a lot of protection. We have vitamin C, we have vitamin E, we have coenzyme Q10, antioxidants to beat up the free radicals when they're generated by ultraviolet light. The problem is, after about 30 to 45 minutes, we completely deplete our endogenous antioxidant pool. And so the free radicals start running wild now, and they trigger messengers in the cell. And those messengers are called transcription factors. And when you trigger transcription factors by free radicals, you trigger transcription factors that go to the DNA and express genes that will create pro-inflammatory chemicals. And one of the bad actors of transcription factors is NF-kappa B. And when NF-kappa B is turned on and upregulated and it goes to the nucleus and goes to the DNA, expresses over 100 pro-inflammatory chemicals that flood your body. And in the case of skin, it causes a lot of inflammation. That was the inflammation I was seeing under the microscope as a medical student. Another transcription factor, bad actor, AP1. Once again, triggered by ultraviolet radiation that creates free radicals. The free radicals send a message, turn on AP1, AP1 goes to the nucleus and turns on production of some proteins called matrix metalloproteinases. And those are collagen-digesting enzymes. And these collagen-digesting enzymes start breaking down your collagen, which is the basis of the skin matrix. And it causes little tiny, we call microscarring in the dermis. And as it continues, as the process continues, the microscars kind of connect, causing macroscarring, and that's the birth of a wrinkle. So we know that free radicals can activate and act as cell messengers. We know that antioxidants can go in there and turn off NF-kappa B, alpha-lipoic acid, turn off AP1, and so we had some control. But today we've gone beyond antioxidants. And I'm going to tell you a fascinating story as we talk about nutrigenomics, that we have other transcription factors that when they are turned on, they will go to the nucleus and have gene expression of over 15 to 20 powerful cell protective, we call them cytoprotective enzymes. And when I say powerful, I mean so powerful that it could virtually stop inflammation in its tracks, slow the aging process down, prevent the progression of cancer, prevent the progression of autoimmune disease and rheumatoid arthritis and heart disease, and most importantly, prevent wrinkles. If we look at level 2, there was a lot of resistance to that as well. Average mainstream medicine does not like us to take supplements. They say if your diet's adequate, you don't need supplements. Well, unfortunately, they're wrong, and I can fill this room with peer-reviewed journals on studies showing that various nutrients can prevent disease or change the course of a disease or even cure a disease if it's present. And that's very important to know, because if we have that, if we're empowered with this right information, then we can stay out of the doctor's office. And you want to stay out of the doctor's office, believe me. You know, we have a healthcare system right now that's in trouble. It's broken. And so as a physician trained in Western medicine, I think I have the best education in the world, it was interventional. We waited for you to get sick, and then we tried to do something. We can't afford to do that anymore. It's got to be preventive medicine, and the doctor is now you as individuals. You've got to take the responsibility. And so this lecture is critical to all of you watching today, because we will teach you how to take care of yourself. Preventive medicine, so you're not going to end up in a physician's office or waiting in line, because medicine basically is going to be rationed now. And if you're a certain age, you're not going to get certain therapies. And we don't want to see that happen. So we're going to lower that healthcare bill by taking care of ourselves. As a medical student, the first patient I had when I did my internal medicine rotation was a man who was a drug addict off the streets, and I walked in that morning and to look at the charts, and I had a report to my attending physician. My attending physician was a tough guy. So I was very thorough. I'm looking over the numbers, and I'm noticing some pretty weird things about the report that morning. That there's something called I's and O's, ins and outs. You look at how much fluid's going in a patient and how much is leaving. And there was this tremendous amount of fluid leaving this patient. And the temperature, body temperature was up. And so I wanted to talk to the patient, and he was unresponsive. And so I started doing an exam, and I pressed on his abdomen, and his abdomen was rock hard. Wow. Never felt anything like that before. And so I wrote up my notes, and my attending comes in and says, okay, present the patient. And I'm like, well, I think there's something wrong. He said, that's not very scientific. So I went through the symptoms, and he said, this patient's very sick. Let's get him to the ICU. What had happened is this patient had perforated the intestine and spilled all of the E. coli into the peritoneum, which is usually sterile, and had peritonitis. And that had moved on to a systemic blood infection we call sepsis. And I remembered that, and sepsis has become a model for aging because in a compressed period of time in the ICU, you will see all the changes you see with decades of aging. Because when those bacteria circulate in your body, this was gram-negative bacteria, but you can have gram-positive as well, you have a tremendous burst of inflammation throughout every organ in your body. And so we had to do things like maintain the patient's blood pressure. It would drop right out, and they'd go into shock. Blood sugar was off the map. And then we had something called the multiple organ dysfunction syndrome. Cardiovascular system fell apart, renal, kidneys fell apart, lungs started falling apart. Everything started happening and very rapidly. This tremendous burst of inflammation. And the physicians thought that the problem was that there wasn't enough oxygen getting to tissue because there was something called a hypermetabolic state going on. And so we administered oxygen, we administered pressors to bring the blood pressure up. We tried to regulate blood sugar with insulin, and then after 24 hours, the blood sugar would drop way down, and then we had to give them sugar. It was just a balancing act. And unfortunately, that patient passed away. And still to this day, septic shock has a mortality rate of about 60%. But let's fast forward now to the future. What the doctors were afraid of was that organs were not getting enough oxygen, and so they were breaking down. And they call that tissue hypoxia. Well, we now know that there is plenty of oxygen available for this tissue, but the cells cannot use oxygen, so you're not getting oxygen use on a cellular level. And it's called cytopathic hypoxia. And cytopathic hypoxia is what I see in the aging process. So I started looking at, well, what are the therapies now in the